So my name is Molly Weingart. I'm 35 years old and I live in Philadelphia, Pennsylvania. I am a second year physical therapy student. I'm getting a doctorate in physical therapy and I'm slated to graduate in January of 2021. So I asked my doctor, I was like, oh, could you give me a breast exam? And I was trying to act casual about it because I thought maybe if I was casual and calm, then it would be fine. And it was a Friday afternoon, and I remember she did the breast exam, and her face got almost cloudy, and she was like, we need to get you an emergency mammogram. And there's a way that I knew I was sick at that very moment. And I grew up, my mom had breast cancer when I was about 10 years old, and she had a series of really serious infections post her lumpectomy. And so being around cancer was something I'd grown up with, but it wasn't something I really understood yet. And so I had the mammogram that following Monday, and then by Friday, I've been diagnosed with DCIS, an invasive ductal carcinoma. And I was taking physics at the time, which is a very important piece of this, in that I ended up finishing physics and neuroscience, and then 5 days later, which was now in May, I had a double mastectomy. So I had my mastectomy in May of 2017, and then I harvested my eggs, and then I started chemo about in August of that same year. And then finally in November 9th, I had my breast reconstruction. When I started thinking about what type of reconstruction I wanted to do, I was very clear with myself that I wanted to get breast implants. And for me, and in some ways sort of as a young person, breast implants and breast augmentation from just a purely aesthetic angle is pretty normal and pretty something that I was familiar with from different friends that I had. And I felt like maybe if I did this, I could keep things being normal, that I could go through having cancer and I could go through treatment, and then I could do something that at the end was familiar in all sincerity. It was such a personal decision for me. My mom opted not to have reconstruction until about a year after I'd finished treatment. And I think that understanding that very personal nature of that choice made it easier for me, because then I could just do what I wanted. Probably one of the most empowering things that can happen to anyone in any area of their life, whether it's illness or not. And I remember that when I had my initial scans, the radiologist was really young. She was about my age. And I went in to go pick up the disc of scans to take to my surgeon, and she sort of came out and said, do you want to go get coffee or something? Like, just let's go talk. And she told me that, she was like, you know what, like a lot of people are about to give you a lot of information, but this choice is yours. Any of these choices are yours. And I feel like that changed my life. I mean, even not related to cancer, and that if you're able to pick what you want, you can own it. I mean, and that breeds a type of freedom that, that there's no resentment of your choices and you're like, oh, somebody made me do it. Like, you have to own what you're doing and you have to be accountable, which just, it makes having to work hard different, and there's a sense of pride that comes with that choice, that it's an internal feeling, and I think you can also see it in a person when they're living their life that way. So my plastic surgeon gave me a wide variety of options, and one of the other options that he sort of included and thought through in the implants was fat transfer, which he did do some of, and I think that added a really nice look to what the finished product was. I mean, if I do say so myself. But, it was something I didn't even know was an option until he brought it up, which I also really valued, that it was just such an open discussion with as much information as I could get, instead of being given, I mean, again, it was instead of being given what was going to happen to me, I could pick. The Natrelle Inspira was the one that I ended up getting, but it was also the first one that I sort of checked out and looked at. And so it was kind of like I mean, matchmaking would be a weird way of saying it, but that's sort of how it felt like, or like the way that it felt when I met my dog, like, you know, where she came to the door and that was my dog. There was no other option. So yeah, it just felt right. There's sort of a joke in the breast cancer community that's not really a joke, that breast cancer is the sorority you never wanted to join. And I think that's true. I think there's a level of, you know, information is passed down from one person to another person to another person, because there's all these things you just don't know. Like, you should bring a lanyard to the hospital so that you can attach your drains to it so you can shower with your drains. And and it's these tiny pieces of information that matter so much. And there's some other organizations that are really meant for breast cancer patients and their caregivers that just provide such powerful pieces of information. I went to Living Beyond Breast Cancer's website so many times. I would type an L into my Google search, and it would be the first thing that would pop up, that there was just medical information that I felt was trusted and wasn't trying to sell me anything. And so I feel like the information comes from this powerful combination of organizations that care so deeply about providing for the needs of this community, and also word of mouth, that kind of connection is really important. And I hope that in the future those types of things keep blending together. So, and that's part of the reason that I feel passionately about still being involved in the breast cancer community, even though I'm in remission. During treatment, still have the most amazing support system I couldn't even imagine. I think that there's so many things I learned from having breast cancer, and one of them is the power of being vulnerable and the power of letting people care about you, which for me personally was absolutely terrifying. And I would talk to my mom multiple times a day, and that wasn't necessarily about wanting my mom. It was about having someone who had this experience. I think that there was an element of our relationship just shifting, from having my mom and me and I'd be her daughter, to all of a sudden there are two women who've had this shared experience. And there was just like a knowing look in her eye when I went to go get my biopsy, that it just shifted. And my friends just, they're just so cool. Like, they would come and they'd sit on my couch with me, and they came to when we had to cut off the rest of my hair. And it's just, and they've still been there as I've kind of had to digest what happened. And I will also say I had amazing medical care. I don't think anyone should ever go through breast cancer without being in very serious therapy. I think that really, really helped. I think that changed the game of having a place to put things, and just really kind of not feel like a burden to everyone. And I had, because I was going to physical therapy school, I knew the importance of having physical therapy after having a mastectomy, which would limit your range of motion. And my physical therapist was someone who had mentored me to apply to PT school, and then she ended up treating me. And having that space of, my body has been hurt and harmed, and you're the person who's helping me get it better, and I'm getting strong again. And I'm going here 3 times a week. We're still very close. I text her all the time. And just my nurse practitioner in the plastic surgeon's office and the chemo nurses, there's just a level of people being able to set aside whatever they're thinking about to say, I'm going to help you get through this. An illness does not affect just the person who is sick. And I think that it sort of radiates out in sort of a wave of circles that the caregivers need to be supported, and the medical care needs to be supported. And I think that there is a way that an experience as traumatic as cancer can, and it's so foreign. I mean, particularly because I was so young. I was teaching all my friends about what breast cancer meant, and that I was gonna lose my nipples, and that, and I was, and here's what a drain looks like, and all these things that they didn't know. There was no reason that they should know yet. And I think that that's that kind of sort of, you feel like a little bit like an alien. And so being loved and scooped up and nurtured and knowing that you're not by yourself is, I think, what got me well. There's two things that I would say to someone who is recently diagnosed with breast cancer. The first would be to tell them what the radiologist told me, was that you're gonna get so much information thrown at you by so many different people who all have their own opinions, but you have to pick your choices. Like, this is your body and this is your life. And so these choices belong to you. And then secondly, and this is something that I think that I started to learn this when my mom was sick when I was little, but that at its very, very basic level, at its most cellular level, cancer is an irrational growth of cells. And just like in a house, if the foundation isn't strong, the house is gonna fall over. And so when you have something that is an irrational growth at its base, everything that comes from that is irrational. There's no way to make order of that. And so I think it's really important to remember that, and that thinking about your reactions to breast cancer, they could be all over the place the entire time you're in treatment and after, and that's completely okay. And so I think that as one thinks through their reconstruction options, it's really, really important to think, what does that mean for me? And, and that might be different from person to person, again, which all of this treatment is. But I would also really encourage anyone who's thinking through it to let themselves feel beautiful and let themselves have reconstruction if they want to, but really sort of balance all the multiple components of what that means. By working with Natrelle, as I feel that in sharing my story, that it's an offering to someone else who is who is affected by breast cancer in some way, and that it's not me wanting to push this on someone else. It's, here, if this is helpful, please have it. If this helps you not feel alone, if this helps you live your life in a way that feels in alignment with who you are, then that's what I want by sharing this story.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue, tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.